안녕하세요. I speak Korean, but I'll just speak English because we have Lolly, a translator, and in the interest of time, it's better to just, keep it as concise as possible. I'm Susan Park, Pak Chi-young from Asian Americans for Housing and Environmental Justice.
Hello, my name is Grace Yu. 안녕하세요. 저는 Grace Yu 변호사입니다. 오늘 이렇게 참석해 주신 분들 너무 감사하고요. We're really excited to share about AB 1400 and what it covers. And let's just start by raising hands. Who has insurance? Who has insurance? Insurance 있는 분, 손 올리세요. Who makes a co-payment or when you go see your doctor, right? Wouldn't it be nice if we don't have to make co-payments? AB 1400 will mean no more co-payments. And David Monkawa spoke about the fact that there are more than 3 million people in California who do not have health insurance. We want everyone to be covered. So that's part of AB 1400.
So, as a Korean American or a Korean person in the diaspora, Kyopo, I think many of us here have looked at South Korea's universal free healthcare system with a great deal of envy, much more so during pandemic. So AB 1400 is not just about free healthcare. It also encompasses bilingual and bicultural healthcare, and this is important for heritage language only speaking Koreans, but it's also important for English-speaking Korean Americans like myself too. I help my mother and my father and my aunt who recently passed away, with their health care, and it helps me to work with Korean-speaking doctors who understand their cultural needs, and they can translate and I can do some of the translations, but I don't know medical terminology. I'm not a medical specialist. So it helps everybody, not just heritage language only speakers.
So, we talked a lot about Obamacare and covered California years ago, and it was an improvement because more people got health insurance. But it did not cover dental. It did not cover vision. And with this new Healthcare for All, AB 1400, we're talking about full holistic coverage for everybody so that you've got your dental, because that's huge. If you lose your teeth, your health goes. We all know that. So it's important that we're going to have full coverage in a holistic manner, and I think that's really important for us to remember about AB 1400.
And Korean Americans have some of the lowest rates of healthcare coverage of all Asian Americans and all Americans. We also have the highest rate of entrepreneurship, owning our own businesses, of pretty much all groups of Americans. And so as small business owners, we often forego health insurance because it's too costly. If we have to provide health insurance for our employees, it adds on to our already, it takes away from our already thin profit margins. So it would help us too as it would help the Korean American economy too in many, many ways, and individual business owners and employees.
So when I go back to AB 1400 and why we need your support for you to get everybody on board, we're lucky here where we're sitting right now because this is in Assemblymember Miguel Santiago's district, and he's one of the co-signers on this, right? He's a co-sponsor. But we have 79, we have at least 30 people who've already joined on this, but we need every single one of our California Assembly members and the 40 senators, and we need our governor to sign on to this. But for this to happen, it doesn't happen in a vacuum. It means people saying, we want health care for all. So AB 1400 is about health care for all, right? It's better than what we're getting with Obamacare. It's CalCare, California Care for everybody. So that's what we're here for. We're gonna rally you up because that's what we need. We need people passionate about all of California being covered under healthcare for all.
And AB 1400 also covers free mental health care. And mental health care should not be stigmatized. We all have issues with mental health. It can be simple things like being, overly anxious, stressed out, afraid. And bilingual, bicultural health, mental health services are of paramount importance. Immigrant communities often live deal with their problems in isolation, and there's a sense of shame, and we don't need to feel this way. We can heal our, traumas caused by assimilation, caused by the demands of a white supremacist society, and our own multi-generational, families too, where we're not talking to each other in maybe the ways we should. So CalCare AB 1400 for All is really about holistic, all-encompassing healthcare, including mental health care.
So we just want to say thank you for joining us for this wonderful session so that we all get geared up to go. And thank you. So if you have any questions for us, we'll be around.
Thank you.